Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Ketoprofen. Its brand name is Orudis. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Ketoprofen is a non-steroidal anti-inflammatory drug that has analgesic properties as well as antipyretic or anti-fever properties. Its action is thought to be due to its ability to decrease prostaglandin as well as leukotriene synthesis. In terms of indications for use, ketoprofen is indicated to be used to treat mild or moderate pain. It can be used for dysmenorrhea or pain associated with menses. And it can also be used to treat rheumatoid arthritis as well as osteoarthritis. Now before somebody was to use ketoprofen, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Patients with a hypersensitivity to ketoprofen would not be able to use this medication. And if a patient had an asthma type or allergic type reaction to aspirin or another NSAID in the past, they would also not be able to use ketoprofen. Lastly, this medication cannot be used for post-operative pain following a coronary artery bypass graft surgery. Now in terms of precautions, ketoprofen is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving ketoprofen to the elderly population unless other pain medications are not effective and the patient is able to use a gastroprotective agent such as a proton pump inhibitor that we discussed in the past. This is mainly due to the increased risk of a gastrointestinal bleed or peptic ulcer disease in the elderly population. If a patient has cardiovascular disease and they use ketoprofen, they may put themselves at an increased risk of experiencing a cardiovascular thrombotic event, such as a myocardial infarction or heart attack, as well as a stroke. Patients should be made aware that anaphylactic reactions have occurred in patients using ketoprofen, and as well, fluid retention or edema has also occurred. There may be an increased risk of developing heart failure while using ketoprofen. And if an individual has advanced renal or kidney disease, then the use of this medication is not recommended. Patients should be told to watch out for some rare dermatological skin reactions, such as Stevens-Johnson syndrome or toxic epidermal necrolysis. And lastly, if a patient has asthma and uses this medication, they would be putting themselves at an increased risk of developing severe bronchospasm. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use ketoprofen, for the most part, they can expect to receive their dose orally, although this medication is also available as a topical cream. If somebody is using ketoprofen to treat mild or moderate pain, as well as pain associated with dysmenorrhea, then they would typically use 25 to 50 milligrams every 6 to 8 hours. The maximum dose in this setting would be 300 milligrams daily. If somebody is using the immediate release formulation to treat rheumatoid or osteoarthritis, they may try 75 milligrams 3 times a day or 50 milligrams 4 times a day. The maximum dose would be the same in this situation at 300 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using ketoprofen, so I'll go over some of those here now. Up to 2% of patients may experience edema, and up to 3% may experience a rash. Up to 10% may experience abdominal pain, constipation, or diarrhea. And flatulence, indigestion, and nausea are also possibilities. Some patients may experience an elevation in their liver enzymes. And some patients may experience dizziness or a headache. Abnormal vision may rarely occur. And some patients may experience renal impairment. Now, some more rare but serious side effects would be the development of heart failure or a myocardial infarction or heart attack. The skin conditions that we mentioned, such as Stevens-Johnson syndrome or toxic epidermal necrolysis. Hepatitis or liver failure may rarely occur. And we also mentioned that some patients may experience bronchospasm. That's all we're going to talk about today with ketoprofen. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.